in a very special episode of Bondi Vet. As Chris joins two of Australia's leading surgeons to try to save the life of our nation's smallest horse.
Oh, it just keeps on coming, doesn't it?
Find out how Coda was born a genetic dwarf and should never have survived.
With Coda's x-rays, that's horrific. For me, it's amazing that he's actually got this far.
Why this woman's love kept him alive.
Life would be incredibly different without him, and I think a lot of people would miss him terribly.
Another pat?
And how the brave little horse is touching the lives of hundreds of sick children.
It's uplifting. It's fantastic to see the kids' reactions.
Now, a deformity in Coda's tiny head is shutting down his airways.
If we don't do anything about this soon, then it will kill him.
Follow his journey as Coda faces his toughest battle.
You've been a brave little fella.
You make my world a better place. I can't depend on you. I can't depend on you.
When I had a call from Lynchy, who's an old vet mate of mine from uni, about Coda, I was blown away. He sounds like such an incredible little guy who's already been through so much.
Chris is on his way to the outer Melbourne suburb of Yarrambat, where he will finally meet the famous Coda.
In a few days' time, he's due to undergo a massive operation. I knew I had to be here and lend a hand.
Looking a little bit sleepy this morning. Right, little guy? Hey, want to go for a run?
Coda was born a dwarf, a genetic disaster with very little hope of surviving.
Hey Lynchy, how are you?
Hey, Chris.
Mate,
How
good
are
to
you?
see you.
Good to see you.
Hey, you must
Thanks.
be Karen.
Hi, nice to meet
Hello.
you.
Vet nurse Karen Stevenson stepped in to stop him being put down.
You are even smaller than I thought.
Just seemed like such a tragedy to end his life after only a few short weeks. He deserves a chance to be happy, and if we can make that happen, then it's worth every cent.
What's that? Is it a smile?
I think he's taken to you, Chris.
He's very special.
He's very special.
He's amazing.
Yeah.
Can I actually have a good look at it, how he gets around? Is that all right?
Of course, yeah.
He gets around all right,
He does,
doesn't
doesn't he?
At only 2 years of age, Coda has already endured several major surgeries.
You can see, though, how he limps there, Chris.
Yeah.
When he was still a baby, the fetlock joint on his left front leg had to be fused to stop it buckling. At last, he could finally stand up and walk. He hasn't stopped running since.
Go, go, go! I'd been told stories about Coda, I'd seen photos, I'd seen videos, but when you actually see him, it's a shock. He's tiny. He barely comes up to my knees. I've seen Labradors bigger than Coda. The list of Coda's medical problems and previous surgeries is bigger than he is. Hello, kids come to play.
As Coda's reputation grows, so does his fan club. Andrew has invited Chris to their daily visit to a nearby preschool.
So, kids, Coda's just going into hospital to have an operation, so you've all got to give him the best wishes.
Hey, good boy. With all this talk about operations, it's easy to forget about what Karen and Lynchy have done for Coda. It would have been easy for them to walk away and just have him put to sleep, but no, they stuck with him. They believed in him and made huge sacrifices. Karen's put off her house deposit just so she could be there and pay for all of Coda's treatment. It's pretty amazing.
Ready? We'll go two. Come on. Chris is
It's really good, isn't it? Coda might come in a very small package, but at the same time, he has such a big effect on everyone that he meets, especially kids. He connects with them, they look at him eye to eye, and I think they see something really special.
Is that a girl or a boy?
It's a boy.
But he got doodle. He's got doodle.
He does have a doodle, yes. Very, very observant, thank you.
The pint-sized celebrity also carries out his own charity work, raising money and doing regular rounds at Melbourne's Royal Children's Hospital.
Lemmy's gonna pat him.
Lemmy's gonna pat him. Oh.
It's uplifting. It's fantastic to see the kids' reactions. It's just such a delight taking him in there and seeing the change that it makes to everyone's day in there, not just the patients, but the patients, the children's parents and the staff of the hospital. I think he likes you. He wants to have a good rub.
Look at Pony. Oh, look, look.
I think think he's saying, you tickled me, now I'm going to tickle you back.
But today at the Yarrambat Clinic, it's time for Coda to become a patient once again.
One of the quirks of dwarfism is that sometimes organs or parts of the body are the same size as they would be in a full-size animal. And with Coda, that's the case with his teeth. He's got full-size adult horse teeth inside that tiny skull of his. That tooth there is that big.
That's right. Yeah, it's hard to imagine, isn't it?
In tiny Coda. The thing that I find most scary about this X-ray is that it's just a head full of teeth that really obscure him breathing in through his mouth, in through his nose. There's no real clear path for the air to get in or out. For me, that really scares me. Everyone's experienced a toothache, but what Coda must be going through with multiple teeth penetrating into his sinuses, causing a pressure build-up, pressing on his eyes, pressing on his brain, it must be horrific. If we don't do anything about this soon, then it will kill him.
Hey little man, you be brave for your surgery?
The risky operation to remove the teeth is scheduled in 3 days. This will be Coda's biggest test.
Life would be incredibly different without him, and I think a lot of people would miss him terribly because he's a big part of everybody's life here.
Inside the Yarrambat Clinic, Australia's smallest horse is busy raiding the staff lunches.
Oh, Coda. Coda, you can't eat that. That's someone's lunch.
Coda's happily unaware he will soon have to undergo major surgery to remove the massive teeth that are shutting off his air supply.
It'd be nice to actually give something back to him, really make a difference to his life, remove that source of pain, remove that pressure, and actually make him happy again.
Today's tracheostomy is step 1 of the risky procedure.
By putting this tracheostomy tube into his windpipe and allowing him to breathe through it, we then free up space for the surgeons to go into his mouth, go into his sinuses and work their magic. Without that, there's just no way for him to breathe under anaesthetic. For me, it's amazing that he's actually got this far. There's 2 really large arteries, 2 really large veins and a really important nerve that are right next to where we need to be making this cut, so that's always going to be the biggest concern. It's the really crucial part now. We actually need to cut into the windpipe. Then we place this tube in that space, and hopefully that's going to be the job done.
Nice job.
And we're in. That now becomes essentially his new airway, his new way to breathe. All right, mate, I'm happy.
That's great. Perfect.
Just going to drop you down, little man. There you go, buddy. Ready? How's that, little buddy? The wild ride, isn't it?
Hold him up so he's sort of in a sitting position. Okay. Whoop. No, he's going to stand.
To clear out any blood from the tracheostomy tube, Chris needs to give Coda a good shake. But the little horse has had enough.
Keep me right in there.
Oh, really?
Thanks, Coda. That was nice. That was nice. You can have legs looking like yours soon. Oh, man. How tough is Coda? It's an hour after the operation. He walks out to his barn, has a look around, looks at me and goes, mate, you did this. Hey, mate. Well, he's gone. I'm in awe of his toughness. But the reality is he's got a much bigger operation still to come, and I really hope he's up to it. We'll see you in a few days' time, Coda.
See you, mate.
See you, mate.
Coda's very good this morning. He is breathing very well after his operation the other day.
3 days later, Coda heads to the city with Andrew and Karen for the operation that will hopefully save his life.
I can't help but be a bit nervous, I have to say. Yeah, I guess it is a bit like having a child going in for an operation. You do feel a large responsibility and you just hope that you're doing the right thing by him. He's just got to get through today.
Hey, Lynch, hey, Karen, how you going?
How are you?
How's the trip in?
Yeah, it was good. All right.
Hey, big man. He's got a special ramp, does he?
He does.
The operation will take place at Advanced Vet Care in the Melbourne suburb of Kensington.
Boy,
That's quite something. Yeah. You are very special, aren't you? And it's a big day for you, isn't it? Mm-hmm. Cool, buddy.
It's an amazing amount of teeth in that small space.
Absolutely, unfortunately, yes.
Associate Professor Gary Wilson, a specialist horse dentist from Queensland, is doing the surgery for free.
It's right up there with doing wombats and koalas, okay, for difficulty.
Can see anything like that?
No, this is definitely a first for me.
Associate Professor Andrew Heggie, an oral and facial surgeon at Melbourne's Royal Children's Hospital, is another volunteer on this elite surgical team.
Well, I've been drawn into it because of the problems of the dwarf miniature pony and some of the problems related to the jaws and the teeth. Coda visits from time to time, and the children's eyes nearly pop out of their heads when they see him pottering by. This miniature horse that's actually alive and not a mechanical sort of device. And I think we want to keep him in good health for as long as we can, for obvious reasons.
If we can't access the tooth properly, or the tooth breaks in the process, we'll probably go to surgery. Initially, we'll start by splitting the mouth on both sides. If that doesn't work, we'll then go to what's called a buccotomy, where we'll raise a flap off the side of the tooth and try and take it out sideways. Okay? And if that doesn't work, we'll then go in through the sinus, which means we drill a hole in his head and go in that way.
For Karen to hear there might potentially be some drilling going on through Coda's skull, that's going to be a pretty tough thing for her to swallow.
The potential for catastrophe is great. One slip the wrong way or an anaesthetic complication and things could go disastrously bad.
So that back edge is actually still molar 1. Molar 2 hasn't even erupted on this guy yet.
Coda's complex operation to save his life has begun. Within a few minutes, Chief Surgeon Gary Wilson has to make a tough decision.
First off here is I can't get my finger back to the tooth that I need to extract. So we're going to split him. I'm going to do a bilateral commissurotomy, which means basically I'm going to make him smile bigger, temporarily. What I'll get you to do while I'm cutting is if you can stretch that for me.
Sure.
That tightens that, which gives me a better cut. Yeah. Pretty drastic way to get a look at the teeth.
It is certainly horrifying seeing him with his face split open, but no, he's all right. He's in good hands.
Now we got access, because that's the tooth I need is 1, 2, 3, 4. So, time to take the tooth out. I'm about to try and remove the gum from the teeth that are affected. So that's what that's for.
The first molar on the top jaw on both sides has to come out.
At the moment, we're just trying to make a bit of space around the tooth we want to remove. Everything is just so jam-packed up there that really space is golden. When using these instruments just to try lever around a bit of room and hopefully once we've done that, we're going to be able to start working that tooth out.
The surgical team has now reached the critical moment. If any of Coda's teeth break off, Gary will have to drill in through the skull.
The hardest thing here is just keeping your patience because this is a really delicate yet forceful procedure at the same time. It's a bizarre mixture of strength and patience.
I can actually now move this tooth a little bit with my finger. All right, let's try a lift. Oh, that's tight. Whoa, Junior.
We've now got it about an inch out of the socket, but the problem is this tooth is up to 4 inches long. To actually get it out inside the mouth is quite a task because it just won't fit to come out. So really trying to suck it back in, isn't it?
You can hear that vacuum then. Go, baby, go. Uh-oh. Oh, crap. Crap.
Change of pressure?
We've just hit a little stumbling block in that we've raised the tooth out of the socket enough that unfortunately it's hitting the other teeth on the other side and it needs to come up along. I've got to somehow get it past these teeth on the other side and I'm not too sure how we're going to do that yet.
The surgery has now been going for more than 2 hours.
It's coming a little bit at a time.
At last, the team's patience is finally paying off.
Go, baby, go.
Oh, it just keeps on coming, doesn't it? Oh, here we go.
Oh.
Wow.
Oh, my goodness.
That's extraordinary, isn't it?
Sure is curved.
Look at that. You look at that there, inside that tiny skull. The maths just doesn't add up. And Coda's really paid the full price for that. That's incredible. This is the first tooth cleaned up. It's just absurdly large. I mean, this is enough to put the tooth fairy into liquidation. It's ridiculous.
After another 30 minutes, the second tooth is ready for extraction.
Well done.
Here we go.
Oh,
Jeez, well done.
it's a boy.
That's it there.
Done. Well done, team.
No, mate, well done you. That was
fantastic.
extraordinary.
Great stuff.
Now we just got to put Coda back together.
Yeah.
Very happy, yes. Yeah, no, all's gone swimmingly well.
For me to be a part of this surgical team and actually take part in this operation for Coda is special. But to know that it is a life-saving procedure, it's really something. You just need to look at the faces of Lynchy and Karen to see the relief.
We expect so much maturity of him, don't we? You forget that he's just a little baby.
It's a tough little fella.
He's a tough little fella. Made us all very proud, mate.
Incredibly, Coda is back up on his feet only 15 minutes later.
Take it slowly now.
But it will take him at least a month to fully recover.
He's going to play the little tough guy and carry on as though he's in no pain at all, but he'd be feeling it right now.
You're a remarkable little fella.
He's a small little man, but he's had to become a big guy on the inside to go through and overcome all these hurdles. How's the patient this morning?
He's doing really well.
Yeah.
He's got a little bit of swelling in his cheeks.
Yep.
But his appetite's back, and we're really pleased with how he's going.
Next day, Chris meets up with Andrew and Karen to check on Coda.
Oh, look at you. How you doing? You okay? Good. Check, is there no tooth under there? So tooth fairy's obviously been.
Tooth fairy's been.
Yep.
After his surgical ordeal, Coda is living up to his reputation as the Iron Horse.
He looks like someone that's had their wisdom teeth out, doesn't he?
He does, yeah. He's got that real chipmunk look about his cheeks.
Yeah. I've got to say, I mean, you look at what he went through with that operation yesterday, it was quite a forceful procedure, but true to Coda's nature, he bounces back, shakes it off, and away he goes. You're back on track now, aren't you? Nothing's going to stop you. More food?
Literally within an hour of the surgery, he was looking around for food, doing his old normal things, you know, sort of bumping up against us, wanting a scratch, being his old normal self. And I was just absolutely chuffed to see that. He's got a lot of character, Coda.
The dwarf horse, who is not meant to live longer than 6 months, will now be around for many more years.
Coda, just slow down, buddy.
A lot of kids look at Coda and they want one. He's a very cute little pet. Coda is not an ideal pet at all. I wouldn't encourage anyone to take on a pet like Coda unless they are specifically able to deal with the many health problems that his condition entails.
Knock, knock.
Only 6 weeks later, Coda is back on the rounds at Melbourne's Royal Children's Hospital.
I think he's very cute and he loves to see people, like to come and visit kids here at the hospital. I think he's nice and soft.
Hopefully now the little horse's battle against chronic pain is finally over.
He has been through a lot. He has been through significant periods of convalescence where he's had to overcome significant surgeries. So yeah, I think he can probably relate to the experience of being in hospital. I think he can continue doing his good work here, and he obviously brings a smile to all the kids' faces here. It's fantastic to see. So the team's back together and we're hoping to have many good years together.
I'm lucky enough to see animals every day of my life, but there aren't many that come along like Coda. He's the smallest horse in Australia, but he's one that's probably left the biggest mark on me.
Hi, I'm Dr. Kate, and if you enjoyed this video, make sure you subscribe to the Bondi Vet YouTube channel. Click on the screen for more great content. And for free, exclusive, never seen before Bondi Vet stories, you can sign up to bondipet.com, and you can do so via the link in the description.